Shall we start now? Yeah. So, friends, once again, thanks and welcome for accepting our invite and for this round of briefing of the latest developments related to the PABS negotiation. So, all of us are aware that the next week, the PABS negotiation will be resumed in Geneva for a week, and after that, there would be another round of negotiation in the month of March. So as of now, there are only 2 rounds of negotiation left for the PAPS negotiations to be concluded, if at all. It's going to be concluded during the not during, prior to the upcoming World Health Assembly. Against that background, what we are witnessing right now is is a mechanism will be in place which might be far below than an existing framework, which Nitin will explain. That's a pandemic influenza. Pandemic influenza preparedness framework. So this mechanism will be far below than what.
Gopa, you're muted, Gopa.
Sorry, by accident.
And your video is off, so maybe you can turn on your video as well.
Yeah. So can you hear me?
Yes, yes.
Am I audible now?
Yes.
Yeah. So as I mentioned earlier, there would be only 2 more rounds of negotiation as of now. But the ID Bureau can schedule further round of negotiation. But we are going to witness a framework. If it goes this kind of direction, then we will be witnessing an agreement which will facilitate the sharing of pathogens and related digital sequence information, which goes far below than what is the current framework. That is the PIP framework, may lead to a risk of legitimizing a kind of an extractive mechanism, which is resembles the or reinforcing the kind of neo-colonial relationship. So against this background, let me invite Nitin to provide an background as well as and explain the key issues at stake or key issues of concern related to the current PAPS negotiation, as all of us might be aware of the fact that the Bureau has come out with some kind of text which is at least available for the stakeholders can access it, that provides a kind of a framework for the proposed PAPS mechanism. So Nitin, floor is yours.
Your mic.
Thanks a lot. I hope my screen is visible. Thanks everyone for joining the session today. I'll make a short presentation regarding the PAPS negotiations and the Bureau proposals and some of the key elements which we need to be focusing on in achieving greater equity. And what we see in the current negotiations is that some form of loopholes are being designed deliberately into the system so that the kind of legal certainty which we have when it comes to access to medicines through PAP system is getting affected. It is also, on the other hand, kind of promoting, or not, if not promoting, making the environment more prone to biosecurity risk. So let's see what this is in a very short manner. So let's see what PAP system, what is the introduction. So you all know that the World Health Organization adopted pandemic agreement, last World Health Assembly, and Article 12 of the pandemic agreement established PAPS. Now, how to operationalize this pandemic, this PAP system, which is the pathogen access and benefit sharing system, will be detailed in an annex to the pandemic agreement. And this annex is currently under negotiations in Intergovernmental Working Group composed of WHO member states. Now, what is this system about? The system actually promotes rapid access to biological materials and sequence information, meaning the order of nucleotides and amino acids, etc., in particles like DNA, RNA, and proteins of the pathogen with pandemic potential. And at an equal footing, when these biological materials and data has been shared for research and development, at the same equal footing, there will be promotion or sharing of fair and equitable benefits, including vaccine therapeutics and diagnostics, which would be effective on these pathogen with pandemic potential. Now, parties undertake under the system to facilitate sharing of pathogen specimens and sequence information, and the recipients of these data or materials would sign agreements to share benefits. And this is the only provision in WHO pandemic agreement which provides legal guarantee for equitable access to the health products such as vaccines, therapeutics, and diagnostics. Now, what are the major benefits which we can expect out of this PAP system in terms of equitable access to medicines? If we look at Article 12, there is clear guarantee or clear language on access to VTDs during pandemic emergency. What is that commitment? That there will be 10% of the real-time production of these health products as a donation to WHO to be distributed for vulnerable communities and populations around the world based on certain analysis about public health risk and needs. There is also an agreement that another set of percentage up to 10%, it could be 2% also, of real-time production reserved for WHO at affordable prices during pandemic emergency. Now, what does this mean is that WHO don't have to stand back in the queue to get access to VTDs, which we would all have experienced during COVID-19 pandemic. So idea is that the real-time production is reserved for WHO's use at affordable pricing. And if WHO is able to make that commitment on prices, etc., that reserved doses or reserved production will also be given to WHO for the purposes of coordinated response to a pandemic emergency. Now, the question is whether we have access to VTDs before a pandemic emergency is declared. So there is an understanding under the Article 12 that a public health emergency of international concern, like it's the first declaration comes out of international health regulations. When you have an outbreak, you assess the risk of the outbreak, and if you feel there is the WHO and the emergency committee understands that there is international concern, then they will declare it as public health emergency of international concern. So it's a stage before the WHO declare an event as a pandemic emergency. So even at that time, there needs to be access to VTDs. But Article 12 do not give details regarding this particular aspect or during how access would be shared at this point of time. There is no mention about set-asides or donations or reserving products for WHO. So this is one aspect, but it is said that there should be benefit sharing provisions to address PHEIC, and there should be options for manufacturers in providing these benefits also. That's mentioned in Article 12, paragraph 7. Same thing about stages before announcement of PHEIC, declaration of PHEIC, that is outbreak stages, to prevent an outbreak from becoming an emergency of international concern. There needs to be access to VTDs. Again, it is a commitment under Article 12.8, but it's not very clear how this access to VTDs will be operationalized. Now, there are other two aspects of benefit sharing, which is also seen in Article 12. One is licensing for manufacturing in developing countries. And another is monetary contributions when, if the commercial users or the pharmaceutical companies or even other users, like, for example, AI tool developers, etc., if they use the PABS system to develop certain softwares or prediction algorithms, etc., which is proprietary, and they sell it, they make commercial benefits out of it. They're all expected to put in monetary contributions to the PABS system. So these are the benefits which we are expecting, but whether these are all getting translated into operational provisions in PABS Annex is a big question we have to face. Now, what is the previous experience of WHO in managing such a system? So I would say there is a system called Pandemic Influenza Preparedness Framework, PIP framework, which is really, I would argue, one of the most functional operational multilateral systems of ABS in the world. There are other systems, but the way it has so far delivered on equity is, I would kind of at least say, remarkable when compared to other multilateral access and benefit sharing paradigms or regimes in the world. Now, what is at the heart of this PABS system? I would argue contractual agreements which provides legal certainty. So what is these contractual agreements? As I said, when we are sharing pandemic pathogens, pandemic potential pathogens, or the biological materials, particles of those pathogens, generally the practice is that when laboratory to laboratory shares, they sign up something called as a material transfer agreement, right? And the idea is that this material transfer agreement will be standardized for the use of the PAP system, so that whichever laboratories are the part of the system, when they share these materials, they sign the standard material transfer agreement, which will elaborate on how the material should be used, when the material can be given to a third party, let's say, for example, a pharmaceutical manufacturer or a developer, etc. What sort of reporting the laboratories and the recipients have to take into account, right? And what sort of benefit sharing obligations apply, so that when you sign this agreement, all these obligations is generated upon the recipient of the VTDs. It's not necessary that everyone has to provide VTDs. That's how sometimes Europe, as well as some of the northern delegates, speak, and they say, oh, only manufacturers have to sign this agreement. If others sign this agreement, how will they provide VTDs, etc.? They don't have VTDs, etc. That's not the way we have to understand SMTA. SMTA is a material transfer agreement. When you share a biological material, you make the recipient to sign this agreement to undertake certain terms of use. And as a part of that terms of use, whatever benefits you develop would also be shared equitably and fairly with the rest of the world, or through the multilateral system, through WHO. That's the idea. The same thing, you will also share data, that is sequence data, genetic sequence data or sequence information. At that time, what we are supposed to do is basically to sign a data access agreement, right? This is also a part of current academic practice in many databases, not all databases. And I would argue it's not also part of some of the dominant databases which the global north runs, right? But there are certain other databases, including those coming from global north, which actually employs some ideas like user registration, verified user accounts, and data access agreement. Any of us would be very, very much familiar with these kind of agreements because we are using regularly, accessing libraries from, various universities around the world through electronic media. So the idea is you end up using databases through user registration and data access agreement. And this data access agreement will also tell you what are the terms of use of this data, of the sequence data. What are the conditions when you can share it with someone else? When do you need to report back to WHO? And what kind of benefits you might have to share, depending upon your use. So these are two crux legal instruments which ensures benefits such as VTDs are legally guaranteed, or the delivery of VTDs are legally guaranteed, rather than the other provisions in the pandemic agreement, which is more or less relying on the goodwill and charity, or even, the languages are a little bit, I would say, diluted with caveats and loopholes. Whereas here, we has this opportunity to ensure there is predictability in access to VTDs. So just to say that non-monetary benefits, such as access to VTDs, like the set-asides for donations under affordable pricing, or licensing to manufacturing to developing countries, and dissemination of results of R&D undertaken on pathogens, etc., annual monetary contributions, all of them will be part of these benefit sharing obligations and contracts. These contracts could also be, if you follow some of the patterns in FAO, etc., there are many facilities like ECSMTA, click wrap agreements, etc., which would accelerate the way people can conclude such contracts. So this is how it is. And in order to see what WHO has been doing in the pandemic influenza virus, the pandemic influenza preparedness framework, a precedent of this model, right? We just want to show that this is a working model, and it has been serving WHO member states for several years now. So what happens in the PIP framework, which is specifically for pandemic influenza viruses, countries share the pathogen materials or the biological materials of the parts of the virus through a laboratory network called GISRIS network. And they sign, all of the laboratories sign something called as Standard Material Transfer Agreement 1. And this deals with what laboratories can do with this particular biological material, which is shared by the countries or the laboratories from each of these countries. These laboratories can also share these materials, including candidate vaccine viruses, etc., to pharmaceutical developers and researchers through using another standard material transfer agreement, which is also negotiated and adopted by Health Assembly, called as SMTA2, right? So the entities outside, it's not only pharmaceutical manufacturers, universities, other researchers, etc., all sign this SMTA2 and access these biological materials of the pandemic influenza virus. As a part of this agreement, they undertake when they make benefits, to share benefits. And if they are manufacturers of VTDs, they keep set-asides to share to developing countries and vulnerable populations through WHO. So VTDs are mentioned in the SMTA2. There is also partnership contributions when pharmaceutical companies become as a member of this particular system, or if not a system or a partner of the system, they agree to make a certain annual monetary contribution so that the system is run, so that and also capacities are built in different parts of the world. So this I would say annual monetary contribution as well as VTD set-asides go to WHO, and the WHO use it for building capacities in different countries, the money, and the VTDs are reserved at the time to be used during a pandemic influenza event that might happen. And the implementation is overseen by World Health Assembly, WHO Director General. There's an independent advisory group called PIP Advisory Group. All promote and monitor the implementation of the system. Actually, the system is functioning in a way very well. If you see some of the documents from WHO, you could see how during COVID-19 response also, even though COVID-19 is not an influenza disease, how the system is actually working for promoting public health during the COVID-19 pandemic scenario. So there are some gaps in the system. Essentially, the system was developed at a time when synthetic biology is not that developed, and sequence data was not necessarily at that point of time considered as replacing the requirement for accessing biological material. So even though certain mentions about sequence data is there in the PIP framework, it does not deal with it in a very thorough manner, and it kind of allowed some of the databases to continue sharing data anonymously. Now, over a period of time, we can see that there is less and less reliance on the biological materials, and people are moving more and more relying on the genetic data. So this is going to bypass pharmaceutical companies or developers coming and signing SMTA2, in which benefit sharing is committed. So if they're getting access to data and work only on the data, and where they don't have to sign agreements and they can access anonymously, we have lesser chances of SMTA being implemented or being signed in the future. Now, in the SMTA2, apart from setting aside VTDs, there were benefits for licensing, manufacturing to developing countries through WHO. This benefit sharing was considered as an option which the pharmaceutical companies can sign when they, or accept when they sign this standard material transfer agreement. But so far, all these years, this option was never been opted by the pharmaceutical companies. And also access to VTDs is largely for pandemic scale emergencies, not for earlier stages which we were discussed. So these three gaps we wanted to address in the PABS system, and we wanted to follow the good lessons of having this SMTA, etc., and having annual monetary contributions set aside, so VTDs, etc., to be carried over to the PABS system. So there are good lessons as well as certain gaps which we wanted to address through the PABS system when we make the system applicable for the rest of the pathogens with pandemic potential. Now, what has Bureau done? The Intergovernmental Working Group Bureau has now proposed a PABS framework. Now, the major operational elements you could see on the left-hand side of the slide. It's a paragraph from the Bureau's proposal, paragraph 3, which talks of section 2A. It talks about operational elements. It starts with saying the need for a WHO coordinated laboratory network for sharing PABS materials and sequence information, consisting of laboratories that have agreed to terms and conditions as described in section B. So that's first aspect. Laboratory network is being discussed. The second aspect is WHO recognized sequence databases, slightly, trying to come forward in terms of dealing with data. And these databases would agree or have agreed to certain terms and conditions, agree to operate under terms and conditions as described in another part. And then there is a talk about entities using PABS materials and sequence information for commercial purposes, which would sign PABS contracts setting out benefit sharing obligations. There are also the third element, which talks about entities, the fourth element, which talks about entities who would be using these materials and information for non-commercial purpose. They will also have to agree to terms and conditions as described in section C. Now, if you look at this particular paragraph, you will clearly understand there is some form of double standard being applied in the situation. What is this double standard? The issue is here, you're talking about contractual obligations only on the commercial users. So there are laboratories, there are databases, there are non-commercial users or people who use it for non-commercial purpose. They are talking about they would agree to certain terms and conditions, but there is no mention anywhere in the Bureau's text how these laboratories or databases or the other entities would agree to these terms and conditions. Would they sign an agreement? Would they sign a contract? Would they take up something else? We don't know. There is no mention about this. It is clearly following the demand coming from the global north to give up using standard material transfer agreements. And if you look in detail the Bureau's text, there is also no details about how this coordinated laboratory network is built or is formed. That is also missing in the Bureau's text. When it comes to the data, you have now something called as WHO recognized sequence databases. But then even it's not very clear whether these databases will be in any form of relationship with WHO, like enter into an agreement to serve the PABS purposes or etc. And what sort of facilities it will have or what sort of features it will have, such as user registration or data access agreement. What we know from the negotiations is that Europe, Norway, Switzerland, Australia, Canada, Japan, and Korea, as well as United Kingdom, really oppose any form of user registration or employment of data access agreement, which would bind the users of data to share benefits. They're saying there shouldn't be such agreement which would be obligating users to share benefits, inconsistent with what they have agreed under Article 12, which clearly calls for equal footing benefit sharing obligations from the use of sequence information. So the WHO, IGWIC Bureau, as well as Secretariat, etc., is kind of trying to please them and not using the words contracts, SMTAs, data access agreements in these proposals. You could see that kind of differentiate or differential treatment of languages in section A, B, D versus C, where there is mention of contracts. So this is a situation we are in. There is also no mention about tracking mechanism. If you go back and see, sorry, I missed this part, in the PIP framework, whenever an SMTA is signed and a pathogen material is shared or transferred from one lab to another or one entity to another, all the transfers are recorded in a tracking mechanism. There is no discussion about such tracking mechanism in the PABS framework, which has been proposed by Bureau as well. So this is the situation here. Further, we still don't have languages in the Bureau's proposal regarding of the time of acceptance of contracts by commercial users. So if a pharmaceutical company is accessing these materials and data, it is important that they have signed PABS contracts before they access these materials and data. But that timing is not discussed in the Bureau's text. So if PABS data is available anonymously, the question is, why would anyone come to the PABS system and sign these contracts in future? So it is very important that absence of these terms and conditions and contractual obligations on entities like laboratories, databases, or even other users, this would lead to diversion, or this would lead to a situation where the pharmaceutical manufacturers could access these resources of the PAP system without necessarily having a contract being signed. So this is a situation which we would like to avoid. Now let us see what are the benefits which the Bureau's text proposes. Apart from what is already agreed in Article 12, that is during pandemic emergency, you will have 10% donation and another percentage of VTDs for an affordable pricing. That is committed, which is already there in the PABS Annex as well. But when it comes to the PHEIC, which is emergency of international concern, or preventing PHEIC, if you look at the languages on the screen, you could see it is talking about including options, including following options. So what are these options? What is the option available for a pharmaceutical manufacturer to provide benefits such as vaccines, therapeutics, and diagnostics during a PHEIC is not detailed, is not elaborated. Article 12 already says options for this should be available. So in that sense, I would argue the PABS Annex, instead of giving details of operationalizing these options and making at least one or two options mandatory, what has happened is they're just saying following options. And they're telling these options could be, at some point, could be different from one manufacturer to another manufacturer, and they could perhaps negotiate it with WHO, meaning that the signing process of the WHO contract or the PABS contract will not be standardized, and there will be longer negotiations between pharmaceutical companies as well as the WHO Secretariat. So this is going to be a problem. Similarly, with regard to licensing also, you would see this particular language, which is I have highlighted in yellow, which is already in Article 12. It's not adding on to further details in the annex, which means all these things are left to negotiation between pharmaceutical companies and WHO Secretariat. We can understand how much capacity the WHO Secretariat will have to negotiate or to make a bargain which is fair and equitable for developing countries. So in this sense, the commitments from PABS under the Bureau's text is much, much lesser than what has been committed under Article 12, because Article 12 at least says there should be benefit sharing obligations, including options, which means some of the benefit sharing obligations are mandatory. Whereas here in the PABS Annex, it's not very clear which one will be mandatory. The Bureau's text contains only options. So the proposed PABS benefits under the Bureau's text is minus Article 12. That's a significant concern which we are facing. Now, given the scenario, it comes the last important element which we want to discuss today is the emerging biosecurity risk. What is this emerging biosecurity risk which we would like to address? Already, generally, when we talk about biological materials, pathogen materials, the transfer of these materials, etc., follow certain sanitary, phytosanitary measures and biosecurity measures, etc., nationally employed, and international understandings of biosecurity standards or safety standards at laboratories, etc., might be managed. But what we are seeing nowadays is something more than that, which is the sharing of PAP sequence information or pathogen sequence information widely and in an anonymous manner. It is understood now that physical transfer of samples is no longer necessary to create dangerous agents, dangerous biological agents in the contemporary world. There are DNA printers which can make synthetic DNAs and RNAs or other biological molecules which can have dangerous pathogenic effects. So how do currently this particular synthetic production of biological materials, etc., manage certain biorisk? They actually, many countries like US, UK, and Europe, who have so many biofoundries where these DNAs are printed, etc., or made synthetically, they have a list of genetic sequences which creates concern or which creates biological concerns. So if there is a sequence of a pathogenic material, then the biofoundry, when they get an order from a customer to make or to produce a synthetic biological molecule, they will screen whether this order or sequence belongs to this part of, is mentioned already in the list of sequences of concern. If it is mentioned in the list of the sequence of concern, then there are certain other procedures. Either sometimes you might not produce those materials, or sometimes you do a background verification regarding who is this particular person who is making order, what is their relationship with the government, or what is his past, etc., whether they have any antecedents or connections with extremist groups, terrorist groups, etc., and then some form of reporting to the government, etc., will be taken care. So this is how currently nationally biosecurity frameworks are managed. But what we see very recently is that experiments which is showing that AI tools can create novel danger sequences that can bypass the screening from such list. So the list is available, but the new sequence which is given to make a synthetic DNA or RNA or biological molecule, that sequence is a novel sequence. Though it has a dangerous effect, it is not on this list. So even graduate students can actually use AI tools in this manner. These are reported studies in Science and Nature magazines. And there are other, protocols, reverse genetic protocols available openly, which could be used to create synthetic DNAs corresponding to pathogen genomes with a very, very minimal oversights. And we should also understand that at this stage, many cybersecurity threats are also applicable to the machines which generate sequences from biological materials, which convert sequences into synthetic materials, which stores this data in databases and other analytical tools, etc. All these things can be manipulated from a remote locations. There are even cloud laboratories which can be handled from remote locations. So with all these emerging technologies, it is very important for the PABS system to ensure that when it creates a large pool of pathogens and its sequence data, that these are not handed over to anonymous users. It should be known who are the users of these particular pathogens as well as sequence data which we are giving. If we are not having such identification of users, if we are not having visibility of who is using these data and pathogens, the situation is that even sometimes accidents or deliberate research which could create highly pathogenic material, etc., will not even get reported, will not even get visible in the eyes of the government. So it becomes a real problem that it could create, the PAP system itself could become a source for pandemic tomorrow. So this is a real challenge which we face. And we have seen studies now mapping pathogenic genomic databases, which says none of these databases particularly use two-factor authentication or login through third-party accounts. And they are even suggesting requiring stronger passwords, two-factor authentication, implementing login through third-party accounts like ORCID and institution-specific accounts could provide additional security measures. Even the WHO guidelines in 2022 and 2024. In 2022, there are guidelines for responsible use of life sciences, and in 2024, laboratory biosecurity guidance. They actually highlight that pathogen genomic data can be misused, and therefore they require laboratories to use material transfer agreements to deal with the data generated from these materials respectively. So these kind of guidelines and recommendations exist with WHO, but the situation is these are neglected when it comes to the negotiations of developing a PABS annex, and it's not being incorporated into the Bureau's text. You can also see European Union recently come out with a health data spaces regulation, which also deals with these kind of data from pathogens and says that some types of use of this data has to be prohibited, as well as there are provisions in the European regulation which calls for registration of databases and having what we call as transparent user models for accessing data, etc. So these are available at the European regional level, but the Europe keeps opposing these proposals at the WHO, which we see is creating further and further biosecurity risk in the implementation of the pathogen systems. So these are the concerns now, and I think I've taken around 30 minutes. So maybe I'll stop, but before stopping, I'll just take a attempt to explain what's happening, current process at the IGWIC. These gaps which we identified here in the slides regarding the Bureau's text, that no mentioning of SMTA, no mentioning of data access agreements, or relationship between databases and laboratories and WHO, need for tracking mechanism, etc., has all been addressed through proposals made by developing countries. Actually, there is a coalition of 80 plus developing countries called Group of Equity. They have proposed text suggestions, elements, but most of this are ignored or neglected in the development of the Bureau's text. That's essentially because European Union, Norway, Switzerland, Australia, Canada, Japan, South Korea, and United Kingdom oppose such proposals, right? The Bureau would say to developing countries that we cannot take into these proposals because these elements which you have proposed is not going to generate consensus from the global north. But then when we oppose, or when the developing countries say, look, what developed countries want is also not acceptable from our side, the immediate answer is, well, I mean, this is the only way you can build some convergence. So it's kind of heads, you win, tails, I lose kind of situation. But not allowing fair balance between global south and the global north. So this is a real problem. In January, after long discussions for a couple of months until December, what happened was there was informal meetings where stakeholders was not invited, and there were documents circulated to the member states, such as some form of tabulation or some form of table representation about the system of PABS, as well as options for database or data sharing within PABS. And then there was some form of guidance framework for WHO coordinated laboratory network, etc. We were not given these documents to make a comment. It's not circulated. It's not published. The new Bureau proposal, which some of this language was there, was also not circulated during the resumed meeting happened during between 20th and 22nd of January. Only on the last day of 22nd January, civil society organizations, etc., were asked to make comments. But by the time Bureau's proposals were already given to member states, and they had already made their initial remarks and comments, and some of them even engaged some form of text edits with the Bureau's text and others. So it's kind of, we have lost a meaningful opportunity to reflect on the Bureau's proposals and kind of appraise our governments what sort of problems and what sort of the gaps exist in the system. So this is the current status of negotiations. Then, as Gopa mentioned, there are 2 more rounds. One will happen between February 9th and to 14th, and the second round will happen in March 23rd. On March 23rd onwards, 2020 onwards. So that's the status. And yes, I would stop here. Maybe we can discuss some of the excuses Global North makes and whether they are valid or not at a later stage. Thank you. I'll take now questions, or my colleagues and Gopa is then we can make comments. Thanks.
Yeah. So thank you, Nitin, for the presentation. So we will have a very a short video. This is from a last week's brief discussion meeting organized by G2H2 and Third World Network. So this is one of the scientists who she follows these negotiations very closely. She's based out of Namibia, and this is a small portion of intervention during the last week's discussion. So then we can open up the floor.
100% a new form of colonialism, right? And for far too long, African scientists in the developing world have discovered pathogens, right? We've provided the samples, but the medical countermeasures were just produced somewhere else, and then they're sold back to us at these unaffordable prices. So if that's even if we could access them at all. And I think that is really, really dangerous. It's a dangerous position to be in, where you're so desperate to continue your HIV treatment and make sure that your population and that your patients are getting the medications that they need, that you are now forced into a corner, right, to share this kind of health data, because a state's obligation is to protect their population. And where do you draw the line between them? But the crisis also clarifies what we have to demand from the PABS annex negotiations or any other bilateral or multilateral agreements that we go on signing, right? So this pathogen access and benefit sharing system is really the heart of the WHO pandemic agreement, and it was designed to correct the inequities that we saw during COVID-19, right? When pathogens were detected in the global south, but the vaccines and therapeutics were hoarded by the global north. And we want to make sure through the PABS that we have this international legal framework to leverage investments in the regions that need them and ensure that they're not undermined by the kind of funding volatility that we are experiencing right now.